There's a lot of complaints with medication, libido, and other things that can cause a person to stop taking their medication. Medication support services, that's a really a big thing we want to assess for, in terms of what medications have they tried, were there any allergic reactions, side effects, what their experience has been like, and what they're currently taking. It's especially important too to find out if there's been any reluctance to medication or any trouble with taking medication as prescribed, because that's one of the biggest factors in people relapsing with mental health conditions is stopping medication because they don't like the way it makes them feel, or it makes them feel like they have brain fog, or they don't feel as motivated, or they feel more blah. They lose their creativity. There's a lot of complaints with medication, libido, and other things that can cause a person to stop taking their medication. But oftentimes people will stop but not talk to their psychiatrist or provider about it because they're embarrassed. And so they'll just stop and not say anything, and then we find out that's why they ended up back in the hospital with a manic episode, is because they stopped their medication. They had a valid complaint about it, but they didn't express that for whatever reason, and that's worth exploring because treatment compliance is a major factor in recovery. And for a client or consumer to feel safe talking about any apprehensions of their treatment is equally important to assess for.